Hospice Facebook site for our roundtable discussion tonight on hearing from our local physicians on the COVID outbreak here and what's going on and how to stay safe with it. And so I'd like to welcome you tonight. My name is Pat Canty. I'm the publisher of the Odessa American, and it's my privilege to join these fine physicians here for this discussion. This was the kind of the brainchild. I'd like to say thank you first to Ravi Shakamura of Star Hospice. Ravi's been a longtime resident of Odessa, and he started Star Hospice a while back, and it serves an 11 county region. And it was Ravi who said, we hear daily briefings on social media, on television, all over. And a lot of it comes from a public health perspective. And Ravi thought it would be a good idea to bring these physicians together so that people could have the opportunity to hear from the doctors themselves who treat patients day in and day out in a variety of settings. And so that's what we're going to do tonight. We have some of them joining us. They're good enough to join us this evening, and we're going to have that kind of a casual discussion. And as we do that, if you have a question, please send a message on the Star Hospice Facebook page. And what they'll do is they'll collect those messages and they will send them to us. And as we get an opportunity, we'll throw those questions to the physicians and see what we can get some answers to. So with that, I want to welcome our physicians. They're all outstanding, and they've all been here for quite some time. The first I'd like to welcome is Dr. Jayaram Naidu. Dr. Naidu is an institution. He's been practicing internal medicine in this region for 42 years, and he's president of the Naidu Clinic. Dr. Naidu was appointed by Governor Greg Abbott of the Texas Medical Board, and he's an assistant clinical professor at Texas Tech Health Sciences Center in Odessa. And he's also a member of the Texas Medical Association. I could say more about him, but it would take up our entire hour. So with that, I'm going to move on to our next physician is Dr. Suresh Prasad. Dr. Prasad has practiced in the Odessa area for more than 20 years. And he likewise is an assistant clinical professor at the Health Sciences Center. He's board certified in internal medicine, sleep medicine, obesity medicine, and diabetes. He's a real specialist in clinical hypertension. And let's see what else. He has extensive, as well as the others, extensive experience now dealing with COVID patients in an office and critical care setting. Next, welcome Dr. Satish Nayak. Dr. Nayak comes to us from Andrews, and he's going to bring a great perspective from kind of the rural healthcare perspective, as well as the obstetrics gynecology specialty. He's been practicing there for over 19 years. He also was appointed by Governor Abbott to the Texas Medical Board. He also serves as an assistant clinical professor at the Health Sciences Center. He's going to have an interesting perspective because with his experience in obstetrics gynecology, he's been able to focus more on the COVID impact on pregnancies and lactation. So, we need to remember that the virus has different symptoms, affects people differently. And so that's a critical kind of cohort or critical demographic that he's going to be able to address. And then we have Dr. Anand Reddy. And Dr. Reddy is a board certified internal medicine, but he's also board certified in nephrology. And he has been kind of practicing in Odessa and the surrounding West Texas area for 9 years. He's director of the Permian Basin Kidney Center. He's an associate clinical professor at the Health Sciences Center. And he was recognized as received the Service Excellence Award for Core Values and Service by the DaVita Physicians Leadership Group. What he brings to the table is he sees patients on an outpatient basis, but also on an inpatient basis in the hospital. And then, of course, he sees patients with kidney conditions and the types of effects that the COVID virus the special kind of circumstances or kind of effects that it presents to those patients. So with that said, I welcome all of y'all tonight. I'm glad y'all made it. You can see Dr. Nayak is just got off work. He's still in his scrubs. So we're all here tonight. So what I'd like to do is kind of kick this off and start with, we're headed into, obviously it's a flare up locally of the virus, but it's overlapping with flu season now. We're headed into flu season. And there are probably people out there wondering, there's some people probably wondering, well, what's the difference between the flu and COVID-19, other than the fact that COVID-19 is pretty deadly or pretty serious, highly infectious, but also different symptoms, the difference between the viruses and possibly the symptoms, what to look for to differentiate that. Dr. Prasad, I'll go ahead and just throw it to you to kind of kick that off and help us understand that.
So both COVID and the flu has a lot of overlapping symptoms like fever, cough, shortness of breathing, fatigue, sore throat, running nose, muscle pain, headache. But there are some specific symptoms that usually you see in only COVID, like loss of appetite, loss of taste, loss of smell. Sometimes they present with like confusion, usually not seen in the patient with flu. So these are most of them are overlapping symptoms, but some of them are specific symptoms, which is mainly seen into the COVID. However, the COVID usually is spread easily, and it has more serious illnesses, as we have all known about it, like the death, as we all know. It takes longer before the symptoms start and stay contagious for longer period of time, COVID. Usually the incubation period is somewhere from 3 days to 10 days, but it can be as early as 2 days, or it can be as long as 14 days. However, in the flu, usually it is somewhere from 2 to 3 days.
What is, kind of throw this to all of y'all, what tends to be kind of the top three or the most common that you're seeing in your patients, symptoms from those COVID sufferers coming in? Is it loss of taste?
It's a fever, sore throat, shortness of breath, fatigue, sometimes gastrointestinal symptoms. And these are the symptoms. So usually 40% are asymptomatic. Then some are pre-symptomatic. That means before they develop symptoms, it may take 3 days. Therefore, asymptomatic, pre-symptomatic, they consist more than 60%. Therefore, everybody next to you may be a suspect. Therefore, it's not only the symptoms, but beyond that, asymptomatic, younger generation, pre-symptomatic, they may be doing good, they may be infectious. But after 3 days, they may get symptoms. They already had parties before that. Mm-hmm. That's why it's a strange, novel virus, very contagious. Like Dr. Prasad said, sometimes it can cause more serious illnesses. The percentage may be low, but definitely they call cytokine storm. Once if the immunity go overdrive, they really get into problems, which is life-threatening. Mostly people with other comorbid conditions like diabetes, hypertension, obesity, etc. Therefore, now when we call it twindemic. That means two things. One is flu, another one is COVID. They call a new word is coming from CDC. They call it twindemic. Therefore, if you have symptoms, they overlap so much. You just have to make sure. The only difference is the taste and the smell. These two things. But they also need to know when they have to go to hospital, when they stay at home, when they need to be tested.
So let me throw this out because we just had one of our viewers ask, does the loss of taste and or smell automatically mean you have COVID? Or is it?
I don't think I know percentage, maybe others know, but
yeah,
that is one of the cardinal symptoms.
Yeah, that is more specific as I said earlier, that is seen more so into the COVID patients than into the flu patient, number one. Number two, that several studies has shown that the people who have loss of taste or loss of appetite, they usually tend to have a milder version of corona and more milder version of COVID infection, number one. Number two, also they usually they get better quickly, and it does like. But if you can have loss of taste and loss of smell in other conditions like sinus infection, allergies. Like sometimes if you have a nasal polyp, you can have loss of smell as well. So, but it does not mean that you have it if you have just a loss of smell or loss of taste.
And to add to these points, ours is a little unique population, the dialysis patients. They need life-saving procedure every other day. They do come to the dialysis unit every other day. The more of our dialysis patient, the way they are presenting is very milder, generalized weakness, diarrhea, rather than a frank fever, a running nose, cough, which is not so common among the dialysis patients. I thought it's only our patients, but when we looked at the national database among the dialysis patients across the country, this being the case. They do come to dialysis every other day, so we do have a chance to see them and ask them questions. We have a pre-questionnaire where we see how you feel in the last 48 hours, because they come back every 48 hours. So we get if there is any change in their symptoms, we immediately try to evaluate and see if there is a chance for a COVID. We try to isolate them from the general other dialysis patients. So we do see a GI symptoms like diarrhea, generalized weakness, more than the typical standard that we see in a regular population.
So
talking about the population that I was going to discuss later on, I mean the pregnant and the lactating women, I find that their symptoms are very much similar to pretty much of the general population. And I had about 4 patients who actually had COVID, did extremely well, and in fact did better than some of my normal patients who are not pregnant. So why this happened, we don't know. I mean, they initially came up with loss of taste and smell, and maybe like Dr. Prasad mentioned, maybe if people have those symptoms to start with, maybe they get a milder version of the disease. This is something that we need to do more research on, I guess.
I think it's interesting because how it affects different people, like the pregnant patients. I don't know if it's because of the hormones in their bodies at that time, or your dialysis patients. And that's one of the questions that someone just sent in a little while ago. I think the perplexing thing about this is, why do some people get it and they get it so bad, and some people get it and it's just kind of like, oh well, not that big a deal. And maybe say more about that. I know that the predispositions for the seriousness of it are things like obesity and things. Maybe talk about some of that if y'all can.
So that's a very interesting, and that's actually the conundrum of the whole situation. You have two kinds of patients who recover without any symptoms, and those who got that symptoms, less symptoms and recovered fast, they believe that disease is overblown. Then there is the other side where we see patients on a respirator, ventilator, life supporting measures. In spite of all our measures, we are losing at least 1 to 2 patients of mine in the last few weeks, which has never been a case. I've been practicing medicine for 20 years. I've seen a lot of sick ones, but never in my life I've seen that waking up every morning, seeing that 1 or 2 passed away in the night from my ICUs or from dialysis units. It's very, very tragic the way this disease is behaving. What we have learned in the last 6-7 months is, at least we know that there's a few risk factors, the underlying any kind of medical problems, underlying diabetes, blood pressure, or kidney disease, lung disease, or even the obesity is predominant. In addition to that, age is also plays a factor. A lot of the spread that's happening is because of this situation where there are people who get milder version, they feel good, they don't feel like there's need to be so restrictive in their social distancing or masking, and they innocently carry that virus to the families who are vulnerable, who get this infection, and they react so badly. Within a span of 24 hours, we have seen somebody who's talking to you, and within few hours they are on life support, full measures. We are losing them in a flash, which is very, very tragic and sad. It's been the same.
Also, go ahead. We are learning more about this virus, like when it is in Wuhan in China. We didn't know about the clotting, the blood getting clotted. We didn't know about endothelial dysfunction and causing myocarditis and all that. As the time goes on, we are learning more and more. Some of these things, why it happens, why the blood clots easily, why the endothelial dysfunction, which causes the kidney failure, or heart disease, myocarditis, or strokes. These are all part of a systemic inflammatory response to the disease. It's not only one organ. Any organ could be affected. Therefore, when do you go to the hospital is very important for a patient. Anytime their oxygen goes down, trouble breathing, persistent pain in the chest, and inability to stay awake, and mental confusion or bluish lips, any of these things, they should immediately go to the hospital. But all the other symptoms, like a sore throat, fever, mild cough, most of them can do well at home, but they need to contact the physician. Yeah.
So you brought up a good point of the issue of when to go to the hospital, and that sets up a bunch of questions of whens that we're getting a lot of. Is I know people are wanting to know, okay, you answered the question of when to go to the hospital, but when do you contact your doctor, and when do you get tested? Those are some other questions that have come up.
I think anytime when they have exposure, and also when they have fever, cough, shortness of breath, and also when you come from one area where the CDC says a red zone or, level 2, level 3, they're coming here, we need to watch them. We need to test them. And if they're positive, contact tracing, isolation, these things gets important. Testing becomes very important. And or suspected or confirmed having COVID-19 and you have a contact since last 14 days. Those are the ones should be tested. But the testing also, what test you want to do, that becomes another problems.
Right. What is the, I know people have talked about the difference between contact and exposure. What constitutes exposure? I've heard people say if you've been 15 minutes or longer. Can y'all, Dr. Prasad, maybe can you talk about some of those kind of tips that people can keep in their head that are easy to remember?
So the contact means that any patient if you have come across any patients who have positive for COVID and you have, then that is contact. But exposure means if you have come across less or more than 15 minutes exposure. And even with the asymptomatic patients or pre-symptomatic patients, as Dr. Naidu was saying, those patients need to be quarantined for 14 days as per the CDC guideline.
And then let's talk about tests, because there's rapid tests, there's the PCR tests, I believe. And I know that there's been some issues with rapid testing that there false negatives, and then someone goes back to work, and you have problems there. Can y'all, what kind of tests should people be asking for or looking to take, and what should they be aware of?
There are two tests. One is the rapid Abbott antigen test. Antigen is not, it is just a protein from the genetic code. It is not the virus itself. If they are symptomatic, antigen test becomes positive, they are more sure to have the disease. If they don't have symptoms, do the antigen test. Like I had in my family, antigen test was positive, but he never had any symptoms. Then he went ahead and did a PCR test, which is a real encoded viral load. They checked that. That became negative. He didn't have no symptoms. Therefore, that's the place where you get the false negatives and false positives, about 30, 40%. Therefore, this is more a screening for the patients who are symptomatic because it's more sensitive when they have symptoms. But gold standard test is PCR, but it needs a bigger machine, more expertise to do it. Hospitals, big clinics can do them. And it used to take 4 days, 5 days. We didn't have supply chain. We didn't have the swabs. That's where we went into problems. The whole country went into the problems in the beginning because testing had a confusion, even from CDC.
So, Pat, for your question, usually whenever the patient has any questions about testing, it's better to contact their primary. Like if you call Dr. Prasad's office, they go through the questionnaire. Dr. Nayak's office, they have a questionnaire. They will go through that, and they will recommend. Even if they call my office, I tell them, please call your primaries because they are on the forefront, the first line of defense. They recommend the test based on what they feel the probability of somebody being COVID positive or negative. And if somebody gets, let's say, negative on some test, the physician has the ability to analyze the data, saying that, okay, this is negative. Is it really negative or really positive? There are a lot of other factors goes into this. I strongly recommend if a patient has a question, please contact their primary. And Dr. Prasad, you can elaborate on that quickly.
Yeah, I completely agree with what Dr. Naidu said and Anand said. There has been a lot of confusion regarding the test. And because it's a new thing, we are all learning new. And like in the last 6-7 months, we have learned a lot of things. So there are 3 different kinds of testing that you can do. The first test is called molecular test, or that is also called RT-PCR, or it's called nucleic acid testing, NAT testing. So that is the real-time viral load. But again, it takes usually 2 to 3 days to get the report. Now we are able to get the report within 24 hours most of the time because of the, but again, it requires like deep inside your tissue, like, a nasal swab or even mouth swab can be done. And usually what we do is we look at the genetic material. That's what we look at. The second testing is called antigen test, which is a rapid test, which is a screening test. So, that usually what it does, it looks at the protein fragment of the virus. But as Dr. Naidu was saying earlier, the false negativity is almost 20 to 40%. So even if your test is negative, it does not mean, and if you have all the symptoms, it does not mean that you are COVID-free or you don't have COVID. There are 2 different kinds of tests. There is one called Sophia test or Quindle test, and there is another one called it's developed by BD company, which makes the syringes and all those. It's called Veritor test. Usually, it takes about 15 minutes time to get the testing done, and it can be done like a flu test in the primary care doctor's office. But again, the false negativity can be up to 20 to 40%. So even if it is negative, it does not mean that you don't have it. But again, that's a good screening tool test. And the reason why I'm trying to bring this again and again, another day, Elon Musk has tweeted, he got this testing done 4 times himself. And, same nurse, same specimen, same human being, same test. 2 of them were positive, 2 of them were negative. So again, you have to keep that in mind, that it is possibility. And the third test, that is called antibody test, that measures the IgG and IgM. and it tells you the immune response to the virus that you are exposed with or you were infected with. And so that is called antibody test. Usually, again, it may last up to 1 month to 3 months. There are some evidence now we are seeing positive antibody test even after 6 months. But I would say that usually most of the data are supporting 90 days positivity, like 90 days, And again, there are two different kind of immune response you can have, the B cell and the T cell. I don't want to go into that detail, but antibody testing that we do in our office or most of the labs usually it will happen after 2 to 3 weeks after the exposure or infection, and it may last up to 90 days. So these are the 3 testing that we're doing at this time.
So someone has asked too about the cost of a PCR test. I know I hear people all the time talking about, they worry about the cost of going and getting tested. Talk some about that if y'all can. Is it really, I mean, can you get these things pretty much free in most places or covered by insurance or?
Yeah, I think as far as I know, the RT-PCR test is the most expensive, most accurate because the specificity is very high, sensitivity is almost like 98%. So the chance of if you have positive test, you have the virus. The chance of you having the false negative test is like 2% only, but cost somewhere between $100 to $150 depending upon the lab, different lab. In antigen test, somewhere it costs about $26 to $56. But again, it's a screening test, pre-testing, like it gets the report within 15 minutes. Antibody test is somewhere about $70 to $100. But again, you have to wait for 24 hours to get the result back.
The one that you go to, go ahead.
Antigen test is like a flu test. It's the same machine you use. A doctor's office can have it. You can screen it. And but whereas the PCR test is different, elaborative. That's why we didn't have enough kits in the beginning. We took 4 days, 5 days, 6 days. That's where we went wrong. 6 days, you can't wait without isolation for the test. That's where we went wrong in the beginning.
So
Is that the test? Go ahead. I'm sorry, doctor.
Sorry. Yeah, we are doing in the office rapid antigen test. Actually, we got a really nice company from New York who sent us the kits, and it cost the patient about $50. Blue Cross covers 100% of that cost.
Oh, good. Okay.
That's what I received recently, and it has a 88.6% sensitivity and about 100% specificity, and has really helped us a lot, and very affordable and fast test. About the antibody test, I think if you have a test which will give you positive IgM levels, that's more indicative of active infection. When they start measuring IgG levels, that means that you had an infection, but it could have been any time in the past. So basically, I think for practical purposes, I think the rapid antigen test has proven to be a big help. What I do in my clinic is when somebody calls, I do a telemedicine interview right away, because I don't want to expose them to my staff or anybody in my clinic. So generally we do a phone call and we talk and I evaluate them, get all the information, the symptoms and everything else. And then if I feel that they need to be tested, I ask them to come to the parking lot behind my clinic, and I get my staff. I have had a couple of my staff who also have had COVID, and so now they have recovered and they are well protected. So they go out and then they do the test, the swabs for these people, and so that has really helped the community a lot in our area.
I think one thing, it came up earlier, contact your doctor, and I think one thing that this pandemic has underscored for me is that just how important it is to have a family doctor or a personal physician, or at the very least a clinic that you have a relationship with. I think especially with younger people, they that sense of invincibility, and a lot of them don't have doctors. And it's interesting in a time like this because people have questions. What do I do? Who do I call? I had a question not too long ago, and I just called my doctor. And having that person that you can call that is an expert in this kind of thing that can help you through it makes all the difference in the world. I mean, and someone had just mentioned, for example, if you have an oxymeter at home, I believe Dr. Naidu, you were talking about oxygen levels and when to seek, hospitalization. This person wanted to know, well, what if I have one of these meters at home, what kind of oxygen level should I be looking for to be concerned at if I get to that point?
If somebody got 98, for example, drops down to 94, 93, those are the patients, they get benefit early treatment with dexamethasone, which is a proved therapeutic which came out. And before that, they can get benefit with infusing the Lilly monoclonal antibodies. Therefore, when the oxygen is dropping, when they become more short of breath, they have a pressure in the chest, they're confused, they're marked exertional dyspnea, they should go to hospital. There is no other way. Early treatment will help. Once, that's called viral phase. When the real phase where the infiltrates come into the lung gets stiff, oxygen goes down, that is, the mortality in those patients is higher because they may end up with a ventilator. You don't need to go that much. You have to tackle it early. For one more thing, if you go to hospital, in our hospital, we do if the patient is going for surgery, they do PCR test, they're getting 3 hours. The reason is they will be exposed to a lot of people in the operating room. They don't want a test which is not 100%. And they do the PCR test. Or if the patient comes with symptoms in the ER room, they do the antigen test. We have the machine there itself. They will tell you yes or no before I go to see the patient. I already know whether I can get into the room or do I have PPE.
So, Pat, I just want to add one more point. Just before going to the hospitals, please call your primary physicians, because we don't want to overwhelm the system. Our hospitals are already overwhelmed. We just want to make sure there is no panic. Get your PCP, call the PCP, explain your symptoms. There are medications that they can give as outpatient to start with. If symptoms do not get, like Dr. Naidu said, there are few things they look for. They'll ask the patient the right questions and guide you properly. We don't want to, this is the unique situation where the best healthcare system in the world, where we are practicing in America. I've practiced in 3 continents. 3 of our panelists are trained in UK and 4 of us worked in India. I can say this has the most resources. In spite of that, the whole system is overwhelmed. So we are also looking for answers. So the best thing is to call their primary, talk to them. There are a lot of things that can be done before you head to the hospital. Right, Dr. Prasad?
Yeah, I agree with what Dr. Naidu and Dr. Reddy said. But few things that you need to be always keep that in mind. If you're having the one very deceiving thing that happened with the COVID patients, it's called happy hypoxemia. So there is a lot of cytokine storm. So usually your oxygen level will start going down and you may not feel bad. You may not look bad. But if you are having trouble breathing, if you're having tightness in the chest, if you are having, a cold, clammy, mottled skin, if your heart rate is going above 110, if your oxygenation is dropping below 92%, if you're breathing fast, like 24 or more, these are the time when you definitely seek advice from the hospital. But a majority of the people, I know I was talking to Anand another day, the patients are going to the hospital this is a very kind of unprecedented type situation where they don't have hospital bed to admit those patients who are normally they would have admitted those patients, but they're turning them away with the oxygen tank, but again, we don't have to panic about it, but again, we need to know about what is going on, and whoever so has COVID, they should have a pulse oximetry machine. And as Dr. Naidu was mentioning, if you are healthy, if your oxygen is running 99, 98%, you're fine. But if your oxygen is dropping slowly and dropping down 92% or 90%, then I think that is a time when you seek the hospital, ER or hospitalization. But if you're confused, you're not able to stay awake, those are the kind of situation where you should definitely go to the hospital.
So this is good. I think segues perfect into the kinds of questions of someone had already asked. I think Dr. Naidu, when you were talking about the medications, dextromethorphan and Lilly, we use those here. I guess what I'd like to see if we can break down is I have COVID, okay, and what are the types of medications that I can take at home to help me with my symptoms and to give me some relief. And then also the next step is what are the kinds of effective treatments that I can get from my physician on an outpatient basis. So if we could kind of do those two things.
It's just like a flu. It is a type of flu, more infective, can lead into serious illness. You need to treat the symptoms like hydration, drinking fluids, get the fever down with the Tylenol. One thing is there is a study where using an aspirin early, their mortality was less when they really go to hospital.
Okay.
And 500 patients, I think it's, I just read a week ago. Therefore, taking an aspirin because prevent the clots, mortality, morbidity will be less, people who took aspirin. And sometimes if you have superarid infection, there are some azithromycin or Biaxin, one of those medications we can use. If there is a wheezing or coughing much, symptomatic treatment for it. And using the monoclonal antibodies very early has proved like President had it, but we're not able to use it because the cost and accessibility, it has to be given as an infusion. And real data is still not available, how much it is. There are two types of antibodies. One is Regeneron 1, another was a Lilly 1. Lilly 1 is already, hospitals got it. And but there is nothing more you can do except symptoms, taking care of the symptoms, hydrating yourself and isolating yourself. That is very important. Isolating, contact tracing, and those becomes an important.
Dr. Nayak, if any add-ons to that for somebody who's pregnant?
I totally agree with what he said. I mean, what I do is I use 3 medications mainly. Basically, like you said, total symptomatic treatment. The thing about COVID is the mucus. I think the mucus, for some reason, becomes extremely thick. And this mucus actually obstructs the airways. And that's the one which causes the problem with the lungs. Once the mucus becomes thick, gets stuck in the lungs, you end up in the hospital, usually, because that's when it leads to pneumonia and ARDS and all these problems. So the secret, I think, is if you can initiate very strong mucolytics initially, early on, as soon as you get the symptoms, and encourage people to drink lots of fluids and things like lemonade, orange juice. I tell people to do that. It kind of breaks down the mucus, and when that happens, there's less chance of it getting stuck in the lungs and causing future problems. I start them on a very commonly available over-the-counter medication, Tylenol Sinus Severe, which is actually has got a lot of guaifenesin, and that actually breaks the mucus. I start them on also on a baby aspirin because there has been numerous instances of coagulopathies, like clots causing problems. So I started on baby aspirin, 10 years and above. I started them on baby aspirin. And then I started them on, Dr. Naidu said, a macrolide antibiotic like Zithromax or Viaxin, because that seems to be helping a lot with preventing secondary bacterial infections. There is no cure for COVID, but if you take these precautions, at least initially, I think you can save a lot of lives. And when they have trouble breathing, I mean, many of them have trouble breathing, I add dexamethasone in the nebulizer along with albuterol, inhaled dexamethasone. And the good thing about the nebulizer is the solution, albuterol solution, is mixed with saline. Saline itself is a mucolytic. It breaks down the mucus, moisturizes the lung, gets all the mucus out. So if you start all these things early enough, you can save a lot of life. I've taken care of more than 150 COVID patients. We are a small community, and 150 is a large number for a small community. And thanks to God, I mean, if people came to us very early, everybody has done well. So I think if you can follow these simple guidelines, lots of fluids. I also tell them to go out. There has been a correlation between low vitamin D and morbidity and mortality. So I tell them, go out in the sun in the morning and in the evening. You can take supplements if you want to, vitamins, fine. But the easy way, if you just go out in the sun early morning, early evening, if it's not too cold and the sun is out, you can get a lot of vitamin D through your skin. And people, when they follow this, they seem to do fairly well. And the other thing that I also tell them is, don't exert yourself too much. In the beginning, I think a lot of people were recommending incentive spirometries where they have to do the breathing and all that stuff. I tell them, don't do that. I tell them, just breathe normally, because your entire lungs, the mucous epithelium in the entire lung is inflamed. So it's a very fragile, very delicate mucous membrane. And now if you exert yourself too much, you start running, you start exercising, what happens is you're putting more strain on the lungs and you can cause more complications. Right. So I think if you can be stress-free physically and mentally and think positive and do these things, the simple things, I think generally people can get over this thing. Of course, when you have comorbidities like diabetes and if you're immunocompromised, it becomes a little bit harder.
Go ahead.
Yeah, I agree with what Dr. Nayak and Dr. Naidu said earlier, but because, we all practice evidence-based medicine, there is really no evidence-based medicine for COVID yet. As Dr. Nayak and Dr. Naidu was saying, it's mostly symptomatic treatment. Give them Tylenol if they have fever, give them mucolytic agent, as he said, we do the same thing. Give them aspirin for prevention of the blood clot. One thing that I have seen, and I know Dr. Nayak mentioned about vitamin D, it's an immunomodulator, and there are 3 studies that I have seen come across that has shown if the patient who have higher vitamin D level, they have less morbidity and mortality. Couple of more things that I have seen or come across. One is zinc, another one is vitamin C, and echinacea. These are some of the things that they are using to kind of immunomodulator so that fights against the virus. There's not any antiviral medication that we are using at this time to help, or there's none of the antiviral medication has decreased the mortality. There is we all use Zithromax, doxycycline. I have been using it a lot lately, but they're antibacterial. They're really not antiviral. Mm-hmm. They do is they prevent you from getting superimposed bacterial infection on top of the a virus infection that you already have. We have also used some ivermectin, or sometimes we use antiparasitic medications. There was one study from Australia, and I just want to bring it there is called quadruple therapy. And what they have done, or even there are several studies from India because they have a lot of extensive experience with those. And what they said is zinc, vitamin D, if you are using sometimes dexamethasone, as Dr. Naidu said, especially when you are having low oxygenation, these are, in fact, among all the medication that is available at this time, Dexamethasone is the only one that has been shown to decrease the mortality by 22%, 23%. It's only medication. Remdesivir and all those monoclonal antibody, they all shorten the duration of the morbidity. Like, it may shorten by 3 to 4 days, but the dexamethasone is the only one that has shown to decrease the mortality, especially when your oxygenation is running low. But as Dr. Naidu said, we do use medications that, like the viral and antibacterial medication, to prevent them from getting worse. But again, majority of the patients who have milder symptoms, they can be treated at home by just taking fever medication, hydrating themselves, taking the vitamin C, vitamin D, zinc, echinacea, those kind of things, and and not exerting. Another very important thing that I would like to bring it as a sleep medicine doctor, 8 hours of sleep is very, very, very important. American Academy of Sleep Medicine recommends that a normal person should sleep for 7 to 9 hours. So 8 hours of sleep, it gives you a lot of, it takes away a lot of your cytokines, which makes you sick, which causes inflammatory response in the body, as Dr. Naidu had mentioned earlier. So good night sleep is very good. So if you have to take some melatonin tablet, it is also recommended to go ahead and take melatonin to have a good night, 7 to 8 hours of sleep. Those are very, these are all kind of home remedy, but these are all effective unless you are sick, as we had discussed earlier.
And then I guess, Dr. Prasad, I guess if you suffer from apnea and you use a CPAP machine, it makes it even more important that you continue using that, because it is a form of respirator, correct? Absolutely
right. Yes, sir. So again, if you have CPAP machine, you should, and if you have sleep apnea, again, the sleep apnea is the CPAP machine treats the sleep apnea, does not treat COVID, right? But a lot of patients of ours, they have come across and they will say, well, I'm not using my CPAP machine. Why? Because it causes inflammatory response if you don't use that, right? So it is more important that you use the machine while you have the COVID. Also, but make sure you clean it as per the user's guideline, whatever the guideline, has a different, Philips has different recommendations. So put the distilled water in your humidifier, and if possible, try to isolate yourself in a confined room, a different bathroom, so other, like your pets or your spouse or children, they do not get exposed with your machine or with your mask, which may carry some virus. But it's very important that you continue to use the CPAP machine even if you have COVID. It's a mechanical respirator. It's mechanical ventilator. Like if you go to the hospital, that's what we use. We give them like CPAP, BiPAP, or intubation and all those. Right. So we're getting tons of great questions. Go ahead, Dr. Naidu.
And mitigation is very important. 3 Ws. Wear a mask, watch the distance, and also wash the hands, and avoid the crowds. Don't go down to the kitchen, don't go there, just stay alone. And protect yourself, protect others. And that's going to be very important when you have a contact. Mitigation. Mask is the best thing before vaccine.
Okay, it's good that you said that, because someone asked, how effective are masks? So I'd love for you guys to let's talk about that. Make sure everyone understands that. And it doesn't necessarily have to be a certain type of mask, correct?
It don't need to be. It has to cover the nose, the mouth. It has to be thick. It don't need to be K95 or the other surgical masks are very good. And it has to cover good and fit right, because it goes through the nose, through the mouth, through the eyes. And also avoid the breath from each other. The easiest contamination is sharing the breath. 2 guys sit together sharing the breath. That's why distance becomes an important thing. Therefore, it becomes a kindness for one to wear a mask to protect the other. Right. It's no politics here. It is just kindness.
Right.
That's your responsibility. We need to realize that how important the masks are to protect ourselves, protect others, and protect the community, because
Exactly.
it goes exponential way, the growth. 1 infect 2, 2 infects 4, 4 infects 8, and they're super spreaders,
Yeah.
Therefore, this is a strange novel virus. That's why we are going through so much pandemic, since nobody's seen for 100 years, 1,000 people dying each day. If we wear the mask for next 3 months until we get the vaccine, we can save 125,000 deaths.
Yeah.
Just a mask and watching the 3 Ws.
Yeah.
Every day, 1,000 patients are dying. 3 months, how many? 125, 130,000 patients dying. At least half we save. What a thing we can do to the whole community. Therefore, educating the community is utmost important about the wearing the mask, watch the distance, avoid the crowds, and also most of the contacts are from household contacts, not to have big parties at home. This Thanksgiving, me and my wife were there, and that's all, we discuss, we cry, we argue, whatever we do, we enjoy. And that's all, it's going to be there, just. And that message, we need to give it to the community, to community organization.
Yeah,
And how we can pass that on, that will become very important. We are here all together with this, and at least 3 months, if we hold it and do it right, we can really make a big change.
Right. Anand, you had something?
No, I was about to emphasize the same fact about the mask. If there was no mask, imagine the staff taking care of the COVID. So the real warriors here is the nurses, respiratory therapists, the physicians who are in the ICU for 12 hours in a shift. The only thing that is protecting them from getting a COVID when they are really taking care of loved ones or sick ones who are in the ICU with COVID is the mask. It may be a different kind of mask, but it is a mask which is protecting your nose and mouth. Imagine if we are not covering there, the nurses and the respiratory therapists who are spending 12 hours with their patients, right? So mask does work. It does reduce the spread. So we just have to mask for the next. We are so close to the closure. Basically, we are so close to a vaccine. Now it's a fatigue is sticking in, the COVID fatigue. I call it COVID fatigue, where people have been avoiding for 7 months. Now it's very close to the closure. Let's fight another few months, few weeks from all this.
So I want to talk to you more. Oh, go ahead, Dr. Naidu.
Only another thing is I want to address the anti-vaccine group. Vaccines are here. It's a new technology. And our enemy is the virus, but not the vaccine. Therefore,
So it's safe.
Safe. It is safe. It is effective. We know we have done only 3 months trial. We don't know a year. We don't know 2 years. But it effective was 95%. They had 15,000 people randomized trial. The people who received COVID had 8 patients got the COVID vaccine group. Without vaccine group, 186 people had the COVID. But the people who got this 186 and 8 people who got with vaccine, they did not have no serious problem at all. Therefore, seriousness decreases 100%. They don't get into the respirator 100%. And 95%, they'll protect them. It is so effective.
So I heard, I think up until now, that the one vaccine in the world that has the highest effective rate, what is the measles vaccine? That's 90%.
100%.
So this is even more
than that.
So
measles vaccine took 5 years. This takes 145 days. Therefore, the best of America is the speed operation by the president. The worst of this country is not following the mitigation, like masks, and these two things we made a mistake on the second one.
So, someone asked real quick, do you think it's safe to send your kids to school?
That's a difficult question. Number one, kids below 18, they don't suffer, but they will make their grandpa, grandmother, they will suffer. They carry a load of virus. And how do you do that? In some countries, they're doing the antigen test 3 times a week on the kids. See, can you imagine putting that in the nose and rolling it up 3 times a week and to make sure and doing to the teachers? That's a difficult question, but schooling, but more transmission is in the bars, pubs, indoor dining, and the house, not only the school. You need to avoid those things before you close the schools.
What about pets?
That I
You talked
don't
about
know.
pets. Someone actually brought up pets.
I think that time I really never read anything transmission from pets to the humans, but Prasad was telling he read something about it. I'm not aware of it.
Yeah, so usually this virus transmits from human to human, and as Dr. Naidu, I could not emphasize enough how important it is to wear the mask. And any mask is fine. Like, you ask which mask is better, which mask is worse. So even the fabric mask is okay. Like, but both party has to wear the mask to decrease the exposure to each other. Especially for the patient who are high-risk patients, like who are 60 years of age, who have risk factors like diabetes, obesity, hypertension, who are not feeling well, or if they are looking after an ill family member, it's recommended to wear a surgical mask. There are other masks like AN95 or KN95, which is recommended for the healthcare workers. We have some people who use the one valve mask. That is only one valve that goes from one, it will protect you, but it would not protect the person who is across you. So it's very, very, very important. I cannot emphasize enough what Dr. Naidu and Dr. Nayak and Dr. Reddy has already said about using the mask. Now, coming back to the pets and the children, yeah, that's a surgical mask. What you're getting is a surgical mask. Yeah, so that is very good. In fact, that is recommended for anybody who is more than 60. I'm not talking about Dr. Naidu's age.
Oh,
that is
thank
recommended.
you. If you say 60, thank you.
So again, but as far as the pets are concerned, they could not have the symptoms of the COVID, but they can be carrier of the COVID. And suppose if you have a pet at your home, if wife is infected, it can go from there to the cat or dog, and that can infect the husband, even though they are separate, like sleeping in 2 different rooms. That's number one. Number two, as far as the kids are concerned, they usually do not have symptoms, like less than 2 years of old. They do not even recommend to test them. However, there are certain very rare condition called multiple, system inflammatory response that can happen in the kids. But sending them to the school is fine as long as they wear mask and and as long as they follow all the 3 W's that Dr. Naidu had mentioned earlier. But any kind of mask is important, but they need to wear the mask.
Okay. So just to let everyone know, we're going to run a little over, but I think it's important, and I think you all agree. But there's some things we want some ground we want to cover. And Dr. Reddy, I want to continue with you. So let's move into the hospital. Okay, we've had the outpatient treatments. It hasn't gone well. We wind up in the hospital. And that's where you spend quite a bit of your time. Tell us the types of therapies that are working there. Tell us Tell us what it's like. I think a lot of families are frustrated when their loved ones go into the hospital and accessibility is limited and things. Help us understand why in some cases like that. And also, we had a reader just say, our hospitals are full. What does that mean for the rest of us? What are the implications of a hospital being overloaded the way they are? So if you could kind of walk us through some of those.
So interestingly, we have 3 hospitals in West Texas. All 3 of them have capabilities for ICU care. That means we have a care for ventilators, able to take care of the patients on life supports. So once the outpatient therapy fails, the patient comes to the emergency room. They are evaluated, see if they can be managed without a ventilator, non-invasive oxygen or a non-invasive ventilations, which is like a CPAP or a BiPAP, or they need a invasive ventilation, which is a ventilator. That's when our critical care doctors and critical care nurses have been working overtime to give them provide the oxygenation. That's the first step. Once they make the assessment that the patient needs a critical level of care, they go to the ICU, where they may get life-saving measures, including oxygen, including ventilation, including other, if the blood pressures are low, there are medications to help them with the blood pressures, the pressure support, we call it. There's a lot of the critical care doctors, the critical care nurses, everyone works as a team. I come in as a kidney doctor. I see these various of patients who are already have a kidney disease because of who are on dialysis, or they are not on dialysis but still has a kidney disease. And the other group of patients that I see is patients who have received a kidney transplant. They are immunocompromised because they're getting a rejection medications. When they're getting the rejection medications, their immunity levels are low. They are prone for severe COVID infections. Not all of them, some of them. So the biggest group that is the sickest of all, where the whole world is fighting, is the one which goes into multi-organ failure. Multi-organ failure, starting with the lung, where you are not able to provide enough oxygen to the other important organs of the body, then your kidneys also shut down. The same patients can have heart issues, brain issues, all this. These are the patients who are on the ventilators, who are in the ICUs. That's where unfortunately the families are not able to go in. And the families are anxious when your loved one is admitted to the hospital. It's very natural for you to seek help. You try to Google, you try to Facebook. In the era of modern, the social media, everyone has an opinion. This is one disease where probably all 7 billion population has some opinion. So even the physicians are working towards finding the right treatment. The best thing that I've noticed in this disease, the technology and the new medication, it's going to the rural areas of the world so fast that I've never seen anywhere in the past. Like if you have some new therapy comes in for a cancer, for a stomach issue, for a diabetes, by the time it comes to percolate to the local hospitals, it takes some times. But in this issue, as soon as the monoclonal antibody is approved, it's already in the area. Antiviral approved, it's already in the area. The steroids, which has been a standard of therapy for numerous years, it's not new. It's just that it showed it works in COVID. Physicians have been using even before it showed for COVID. They've been, whenever you have what we call a acute respiratory distress syndrome, where the lung is inflamed, lung is not responsive to the regular therapy, they've been giving steroids for many years. It's not new, but the dexamethasone in the British study showed that it does reduce the mortality. So they bombard with the steroids, bombard with all the available evidence-based medicine. The physicians are as curious as the patients and their families to get them better. They are fighting 24 hours. So it's almost like every hospital has a dedicated COVID floors, and those floors are managed by ICU critical care physicians in ICU settings, or in the floors. I have to mention this. Texas Tech has taken a big burden in medical center. Texas Tech family practice have been taking care of all the COVID in the floor, which is doing a enormous service, where we see our dialysis patients who do not need life supporting measures, but they need oxygen, the other measures. So unfortunately, the families cannot see what's going on. They're very anxious. They want to know how their loved ones is doing. There's families, the nurses also, they try to communicate, but they're wearing 2 layers of mask. You can imagine the phone call conversation that is going on. And as I said, there's a lot of information in the social media, the Googles. Believe me, we are going one step ahead. We are going to the CDC guidelines. We are looking at, Dr. Prasad just mentioned a study from Australia. This is the amount of physician effort going on to do the best we can. In kidney, when it comes to kidney, like I said, those who are already on dialysis, they need dialysis. We do the dialysis. But those who have multi-organ failure, that's where we are struggling. Even they don't tolerate dialysis because their other organs are so fragile. If I would try to do the dialysis, some of them tolerate, some of them don't. This is where our frustration is. If they tolerate, we can remove all the toxins, we can get them more fluid out so that they can breathe better. But unfortunately, that's where the most critical section of the population that we are losing is those people who are on life support and the kidneys are not working, where we need to provide their life support. So this is one side of the story. The other side, the hospital is loaded. No, we are making room every day. The CEOs, the CMOs, the CNOs, it's numerous people. It's amazing how they work as a unison, as a team. The West Texas raised up so well. I'm so proud to be part of this community because every one of them, the nurses, the respiratory therapists, the physicians, I can guarantee every one of them have done overshifts, extra shifts. One of my example I have to tell you is one of my dialysis nurse went home at 3 in the morning, had a sick patient at 7. He came back to the hospital to dialyze somebody at 7 in the morning.
Wow.
He slept for 4 hours. He's back in the hospital, back in the ICU, taking care of the sick ones. So they are creating more beds. But the collateral damage, what is the collateral damage? By burdening the system with COVID, we are losing the vital other systems. Let's say somebody has cancer, their treatment is being delayed. Somebody is supposed to get a transplant, their treatment is delayed. In the past, let's say somebody is a liver failure, comes to the hospital, you transfer them to the tertiary centers in Dallas or San Antonio or Houston for a transplant. Now their beds have been closed. So I cannot transfer them, which is sad because these are the conditions which would have been treated in a timely manner a year ago. Now we are not able to. Whereas in COVID, the hospitals are opening up more beds. They're getting more FEMA support. The local nurses stood up. The local team is ready to take care of the patients. But the more less and less we burden the system is better for every collateral issues that comes up with this.
Right.
Can I say one thing? What do you
Sure.
think of palliative care, hospice? That's one point. Second point, I want to give it to the community. I saw a quote somewhere. This is not the year to get everything you want, but this is the year to appreciate everything you have.
Mhm.
And we got 13 plus million people affected with COVID. 270,000 people died. Next 3 months, another 130,000. We simple using a mask, keeping the distance, washing the hands. Why can't we do for ourselves, for others, for the community? That's what I want to pass it on to the community, how important it is. We need to be kind to them. And another one is Dr. Reddy said, is an unsung hero, going in the night, going to places to the COVID patients and all the nurses, respiratory therapists. We need to hats off to them. They are the real heroes.
Absolutely.
Thank you.
So, let's talk about after COVID, because obviously there's all sorts of stories about the side effects, and still some of them are probably unknown. When people have recovered from the disease, what are the types of, facilities, services, rehab care, nursing home, what are their side effects? How can people get treatment for them? Also, if you've had COVID and you've recovered from it, can you get it again? those kind of post-COVID? What does that all look like?
Because the antibodies can last 3 months, 4 months, majority, they can get again. Therefore, even if you have a COVID, you need the vaccination. There's no doubt about it. And post-COVID, you have malnutrition, protein energy malnutrition. You have a myopathy, muscle weakness, they can't walk. They definitely need, if they recover from the inflammatory phase, that is with blood clots, a respirator, they lose the muscle. They need to develop the muscle. Sometimes we can't help. They need palliative care, a comfort care. Therefore, rehabilitation, comfort care, which you call palliative care, those facilities going to need. Other things, residual problems, like sometimes inflammation in the heart called myocarditis or weaker heart muscle, or chronic fatigue, or some neurological symptoms, we don't know, because still we are learning what we are going to see. These are the long haul effects. What are we going to face in future? When you say I will cover all the pre-existing, like all these people who had 350,000 deaths and 13 million people who are affected, they all come out with some type of long haul diseases related to the COVID. Do we treat all of them? I don't know how it's going to turn out.
We are also seeing a lot of emotional disturbances, like anxiety
That's
level.
important, yeah.
Very important, yeah.
Depression is rising. We have a big shortage of psychiatrists and counselors and psychologists. And I think more efforts have to be made to provide these kind of services to the public. The primary care physician himself, I do a lot of counseling, and I'm sure a lot of the primary care physicians do a lot of counseling.
Anxiety.
Anxiety. To alleviate levels of anxiety. And especially now when we have the opioid crisis and fear to prescribe anti-anxiety medications, it's going to be, there's going to be a very fine line between prescribing and not prescribing, especially considering these circumstances. I think the state and the government has to not be like a big brother and watch you. The doctors are scared to prescribe anxiety medications. I think there should be more, training and teaching to ensure that the people get what they need during these times.
Alcohol use, suicide things, and drug use, domestic violence, mental illness, all these things are going to increase. Even staying at home, 2 people, you get anxious. What else you can do? How long you can see television? And you get worried about it. If you get a cough, you're worried. Am I getting COVID? If you sneeze, you worry. Being a doctor.
Yes. So we need to wrap up the questions, I'm being told, but one really quick one. We talked about the vaccine. Can y'all give us a sense of how soon we can be getting it, and how soon do we think the general population will be in a position to have been vaccinated? I think that's top of mind with everyone.
I think by March or April, 70% will be vaccinated. That's just the estimation. And the end of December, healthcare workers, some of them should get it. But we don't have any choice because there is about 4 vaccines are going to come. I don't think I can choose. I want Pfizer, I want Moderna, I want Oxford. Whatever is available, I'll take it in the line. And there are another total 9 vaccines are on the horizon. Russians are doing Sputnik 5. Indians are in Johnson & Johnson. Therefore, I think 7 billion population, 2 shots, we need 14 billion shots. You can imagine how important, how much they have to produce. But our country, I think we have supposed to, somebody has paid money to different companies and made that operation fast so that by April or May, 70% will be vaccinated And that's supposed to give herd immunity to wipe out it. There's a light end of the tunnel.
Good. Well, that's a good way to end our visit this evening. Dr. Naidu, do you have anything else to add to wrap this up as the
I still say mask.
masks?
Mask.
One more thing I'd like to add on, I think,
Yes.
just briefly about pregnancy and lactation.
Mhm.
I think the large segment of the population, is afraid that COVID could cause a lot of problems in pregnant women. Actually, there have been about 40,000 pregnant ladies in America who have been infected till today, and of which about 8,000 people have been hospitalized. There have been about 54 deaths so far, which is very significant. In a country like the United States, maternal mortality is very low. 54 is very, very significant. And most of the deaths were caused by respiratory failure, coagulopathies, and also heart failure. Sepsis was the main reason why they did. The thing is, even though the number appears to be 54 deaths when you compare to these 230,000 people who have died, that seems to be a small number. But the thing is, it is very significant because of our country having such maternal mortality figures. The fear about pregnant women is really justified because it does increase the rate of hospitalization by about 3 times. Rate of bad outcomes also increases. Miscarriages, stillbirths, preterm births. These have been seen in these people who have been infected. And the other thing is lactation. When it comes to lactation, I think these women need not fear about transmitting the virus to the baby. People have done a lot of studies. Considering the small number of patients involved, and there doesn't seem to be any direct transmission of the virus through the breast milk. In fact, breastfeeding protects the baby because the mom has a lot of antibodies already in the body, so she is giving the baby the antibodies. The transmission to the baby, we think, is probably directly, if the mom doesn't wear a mask, and then she can transmit the virus to the baby. But the good thing about the outcome in babies is that they do extremely well. I had a 3-month-old baby who had COVID and did extremely well. The reason they say is because these babies have very low amounts of the ACE2 receptors in their body. The COVID virus actually gets into the cell through these receptors on the cell called angiotensin converting enzyme 2 receptors. And thankfully, in babies and children, that's the reason why the younger population is not getting infected as much, is because they have very little ACE2 receptors in their body. So what I would recommend to all women who are pregnant, don't worry too much, but be careful. Follow all the precautions that you would normally follow, wearing a mask, social distancing, washing your hands, and all these things. But when you have your baby, please go ahead and feed your babies.
Right.
They do better when you feed.
That's great. That's great advice. I can't thank y'all enough for taking the time to visit tonight. Each of y'all are wonderful servants and, dedicated to helping people, live healthy lives and recover when they're sick. And tonight, y'all have gone an extra step in helping to also share information. I think that a lot of people will get a lot of benefit from. Ravi, I'm gonna turn it over to you, and thank you so much for making this possible.
Yes, sir. Thank you. And first of all, thank you, Pat. You are the voice of reason in Odessa and Permian Basin. Thank you for moderating this session so well. And Dr. Naidu, Dr. Prasad, Dr. Reddy, and Dr. Nayak, thank you for making time to go through this process and thinking from the people's perspective and sharing your thoughts and making life a little bit more clearer in these very difficult times. So I thank you all for doing this. And to continue this discussion, we have recorded this session and it will be available on Facebook and also on YouTube channel. So we will be posting that tomorrow. And next Tuesday, we may be having a second session with some specialists, pulmonary and intensivists. So we will regroup and look at these comments. And also, I want to thank all the people who have watched this and participated in this. Please, we appreciate you and all the feedback comments you have shared with us. We will be sharing with the physicians, and we have tons of them. We have so many notes of positive notes for all the physicians for sharing all of your knowledge, which is being appreciated very much. So thank you very much. Follow the Facebook page we have, and we will posting further updates on that. So gentlemen, thank you very much.
Thank you so much.
Thank you, Pat. Thank you.
Bye.
Take care. Talk to y'all soon.
Bye-bye.
Bye-bye.